Welcome to the next episode of the Cannabis Review. I'm delighted to be joined in this episode by Dr. Benjamin Caplan, who's the founder and chief medical officer at CED Clinic and CED Foundation. How are you keeping today, Dr. Caplan?
I'm great, Owen. Thanks for having me.
Thank you very much for coming on. I know you're a busy man with a very busy schedule. You're part of a number of entrepreneurial ventures and medical ventures, and you've got a huge area of expertise in both. And I'm going to touch on those towards the end of the show. But for now, can we start with your book that you've recently brought out called the Doctor-Approved Cannabis Handbook? The link will be in all the viewing and listening positions that you're watching this from. Can you maybe tell everybody what motivated you to write this book?
Sure. I mean, I've seen the common narrative that cannabis is poorly understood. The acceptance of cannabis by the medical sort of community is languishing. The substance, of course, is stigmatized. But the power of evidence and research and advocacy is bringing real patients real relief, and it's just kind of lost on the medical establishment. And it seemed like the right thing to do to collect the patient care evidence that I've seen, the research that I'm doing, and to share it with the public in language that everybody can understand.
Yeah, and you have a huge wealth of knowledge. Some of the statistics I was coming across, that over 16,000 patients you've dealt with, there must be a huge data now that you've built up a huge database. When it comes to the methodology for going about gaining the new information for the book, was there a specific way you went about doing this, or was it taken from data you'd already accumulated?
The medical establishment is just completely left in the dark. You know, I think doctors are not taught about medical cannabis in med school. They're not understanding the therapeutic value. If we were painting a picture, there's a gigantic hole in the middle, which is literally the system which has the most prolific signaling in the human body, and that's the endocannabinoid system. If you imagine the depth of emptiness in the literature that we're learning about, the studies that we're conducting, the treatments that we're providing, of course, patients are missing, one of the systems which causes joy in our body, and to have that kind of as a gigantic missing piece in medical care is ludicrous. So it became a kind of mission on its own. Once I was discovering this, to share it with everybody. I mean, this is something we shouldn't be without. And listeners and viewers might not know, but in the last 100 years is really the only time in human history where cannabis wasn't front and center. We have archaeological evidence going back 12,000 years that this was part of ancient human history, and certainly throughout the rest of history, just until the early 20th century. This hasn't been part of normal dialogue, but it's a human plant.
The book covers 16 different chapters with a host and multitude of elements that can be researched and looked at well. When it comes to the future of the medicine side of things, obviously the receptor targeting drugs and formulations that are going to be able to discover it, is that the kind of the big, huge market that's off in the future that most cannabis companies will get into, or do you think that's going to be dominated by pharma?
I mean, it's not all smoke and mirrors. The perception of cannabis has often been clouded with myths and misconceptions and skepticism. But as more research has emerged, it's clear that the therapeutic benefits aren't just hearsay, that people are really finding benefits. They're rooted in rigorous science and evidence. And that's the underpinnings of the traditional pharma world. They ground pharmaceuticals in evidence, in studies, in clinical trials. Cannabis has just been going through its own natural clinical trial. People have consumed it really forever against all odds and against whatever laws told them they couldn't. And people have found benefit. I mean, there are countries where it's common to cook soup and to drink tea with cannabis, and everywhere else, people just did it because it felt good. It felt right. So I think, slowly the mainstream establishment is catching up with what people have already known.
The study that was published by the Journal of the American Medical Association, that's in your book, that noticed the increase in 65 and over age group in using cannabis. Surely that's the secret untapped market that most people aren't really focusing on. I know everybody thinks trying to get the modern user over into the industry, and it's not going to be via smoking, it's not going to be via vaping. Edibles are not really getting dosed in emulsion technologies at the scale where they should be. So surely that 65 and over who can have a pill for a multitude of different ailments are that secret untapped audience that people should be focusing their R&D on.
Yeah, it's not so secretive. Medicare budget and Medicaid is close to 30 billion, and the government, at least in the US, but really other governments as well, are spending so much money to take care of our most sensitive populations, these older adults. As we get older, the ailments of aging catch up with us. The joints become painful, the days become longer, it's harder to sleep. All of these things, surprise, surprise, are tied to the endocannabinoid system. And if we're not looking and learning about the endocannabinoid system, if we're not treating that, we're just treating half of the people we see. It's just it's a paradigm without a core mission, without a core central piece. The book has, of course, clear chapters dedicated to ailments of aging, not the least of which is cancer. I mean, most of us get cancer. About 40% of people get cancer as we get older. But creating an end of life plan. I mean, imagine we live in a world now where dying is this weird time. Most of us, don't have the luxury of dying with dignity. It's either costly or disconnected from our families when we're getting sick and going to hospitals. That shouldn't happen. It doesn't have to happen. And I think there's a way to incorporate cannabinoid therapies and a cannabinoid understanding of moods, of memory, of feeling joy, which can make aging less uncomfortable.
Do you see the population-based medicine moving towards a more individualistic approach, or do you still think it seems to be a one-size-fits-all at the moment?
Well, traditional medicine, it's one size fits all. You have depression, we got this array of pills to treat you with. That's ridiculous. All of us are different, even one day from the next. You might have a beautiful day or see a beautiful movie and feel differently. Should you be taking the same medicine, which amplifies things as if you're not changing at all? That paradigm doesn't make sense. On the other hand, we've sort of fallen in love with this genetic medicine where, oh my gosh, if we only had your map, we would understand exactly what works for you. But that's not true either. Our map changes. Genes are one thing, but the way they're read is another. Depending on your environment, depending on the foods you eat, the amount you sleep, your manifestation of the code is different. So it's not so cut and dry. I mean, we all wish there was a clear answer that worked for everybody, maybe because it would be simple, but that's not realistic. And what I've found treating patients individually is that it's better for them. Nobody wants to feel like they don't have a voice in their own care. When people are empowered with care that matches their needs, their days, and it changes with life, we're happier. We don't want to be in this sort of silo, this pigeonhole of who I am and who I should be and what I should feel like. People want flexibility and freedom to be different one day from the next.
I'm going to move now on to your entrepreneurial success that you've had. Can you maybe give everybody an overview of what is the CED Clinic's mission?
Sure. The CED Clinic, it's pronounced like seed, like the seed of a plant.
Okay.
The CED Mission is a private medical practice that specializes in cannabis therapies. And EO Care, that's guiding patients with HIPAA-compliant digital healthcare services for cannabinoid-based treatment. So it's sort of the scaling of medical care. A doctor like me can see one patient at a time, and I can get to know them and care about them and evolve with them as their therapeutic journey changes. But how do we scale someone like me when medical school is not teaching cannabis? Doctors are not really plugged in. I think we need a digital solution for that. That's what EO Care is. We're reaching out to broad audiences, learning about who they are, what they need, and then giving them individualized care through a digital platform.
And the successful acquisition you had of Solo Sciences, do you maybe want to give people a little bit of a story on that? It's always great to hear a success story.
Sure. Yeah, no, I'm privileged to have that success. I think Solo was a company trying to give transparency into the system. Around 2019, we had this vapor crisis where people were consuming cannabis and things were happening that we didn't understand that were bad. Of course, that was a little bit confusing tobacco smoke with cannabis smoke, and it was also confusing licensed regulated dispensary products with crud that was made on the street by people that didn't know how to make their products. We've since learned that street products are not safe and dispensary products are generally safe if they're regulated. But during that time, it was important for the public to have transparency and see what was going on. And that was what Solo was all about.
And your work at Green Axe Capital, are they one of the top firms when it comes to investment in America?
Yeah, so Green Access Capital is a unique fund that's raising money from interested and knowledgeable investors. It's led by a team of really the industry's experts in understanding how cannabis can succeed from a business perspective. They look at new startup companies, ones that have started to generate money, but maybe not enough and need to scale. And Green Access Capital feeds that company enough money so that they can grow and succeed. And that success is shared with the business community of investors in the fund. I serve as an advisor, just helping them understand which companies have their stuff together and which companies maybe need more work or need a later look.
And what are your thoughts currently? What's happening in New York? Do you see the medical side of the industry just getting pushed to the side there, or is it thriving, or how are your viewpoints on that territory?
Well, I think New York is struggling with the same struggles that everybody else is struggling with. There's a shift in perspective that leads to a rewriting of our understanding of what cannabis is. Some people think it's only for medicine. Other people think it's only for fooling around. Of course, anybody who consumes cannabis finds it therapeutic. Whether it's an adolescent feeling uncomfortable at a party and just wants to feel relaxed, or a grown-up who's at the end of a day wants to unwind and just de-stress. These are all therapeutic reasons. The unfortunate thing is that people can sell products for a low cost, attract a recreational audience that just wants to fool around and maybe doesn't have enough money, and all of a sudden the medical industry gets washed over. Part of that is because there aren't medical leaders. The medical establishment has just completely lost its way. So of course they're not going to fight for themselves. But that's part of what I'm doing with the Doctor-Approved Cannabis Handbook, is arming the public with what I've learned, with the knowledge to understand the value here, how medical cannabis can be applied to almost everybody in almost every illness, whether it's treating the illness at its sort of foundation or just managing the symptoms of discomfort. There's something in the cannabis plant for everybody. You just have to learn about it.
Is it safe to say the best medical cannabis companies have still not been created yet? Or do you think that the current crop of companies have copped on to the blends and formulations of these specific molecules are going to be able to be an advantageous route for success for a lot of companies?
That's a really good question. I think we haven't scratched the surface yet. Most people out there, including clinicians, think CBD and THC is cannabis. Those are 2 drops in a gigantic bucket. This plant produces hundreds, probably thousands of different compounds, each of which has medicinal value. If we look in the published literature, you can pick off each of those individual molecules and find research on them. You can understand that, oh my gosh, alpha pinene, when I'm walking in the forest and that pine smell, oh, I feel like I can breathe better. Well, guess what? From a pulmonologist perspective, a lung doctor, we see that actually people can breathe a little bit more easily when they're exposed to alpha pinene. And that's one of, as I said, 1,000 different compounds here. There's so much in this natural pharmacy that we have yet to understand. I think traditional pathways, the pharmaceutical industry is not going to be able to use cannabis in the same way that they're used to. I think we're going to have to develop new tools, new understandings, a more natural view of how we can use nature in medicine, which I think is really refreshing. We have to sort of turn a new leaf here on how we care for people.
Fermentation engineering seems to be one of the key areas that could hopefully propel access to these rare molecules and allow for the blends. Whether that seems to come to fruition, we shall see.
Yeah, there's so what you're referring to are sort of different ways to surface these active molecules. One way is to grow a plant and throw it to chance. Organic plants grow wildly. Another way you can do it is to consolidate lots of plants and pick off the parts you want. Another way actually is to grow other vectors like yeast, or like some bacteria can actually produce cannabinoids. These are all areas of exploration to see what people want, what people will buy, and what actually works. So there's a whole industry dawning here that's really exciting.
Yeah, very much so. Last thing before I let you go, if there was one medical cannabis conference in America that you think somebody should attend, what would be your recommendation? Because as we start to see with the conferences, there's more focus on the after parties than there is on the content on the day.
Yeah, no, I don't want to be a Debbie Downer, but I found conferences to largely be commercial ventures. You know, there are a couple lectures that are wonderful, and it's nice to hear learning. There's often regulators and lawyers and hopefully some doctors talking. But the conferences themselves are really an opportunity for vendors to sell products. So as a viewer, as an attendee, you're kind of attending this commercial fest where people want your number, want to contact you, and want you to spend money. That doesn't have much value to me. I tend to speak at some, but I quickly leave so I don't have to deal with the crowds. So I think at the current state of conferences, I usually tell people to steer clear.
Yeah, no, it's a good bit of advice. For anybody who wants to learn more, I highly recommend checking out Benjamin's website. It's below, and the link to buy the book, the Doctor-Approved Cannabis Handbook, will be on YouTube, Spotify. You'll have easy access to be able to get a copy of it front. For now, Benjamin, thank you very much for your time. It's been very much appreciated.
My pleasure, Owen. Thanks for having me.
Until next episode, everybody.